is Dr. Sam Bisson here of Pro Chiropractic. Hey, I just want to take a minute here and discuss with you one of my favorite core stabilizing exercises, the PAVEL press. Now, the PAVEL press was designed in order to activate and train the small local stabilizers within the spine, right? These muscles, known as multifidi muscles, attach each one of these vertebrae here and create stability within the spine. They also are important because when we move, they activate in order to protect the non-contractile structures within the spine. So our discs, our ligaments, and our facet joints, right? Now, over time, when we have chronic back pain, these muscles can deactivate and create what we call a little bit of a latency response, right? So they can either activate late or weakly, or they can actually atrophy or degenerate over time, right? So the PAVEL press is a great exercise in order to activate and train these small muscles to keep our spine happy and healthy, right? So, relatively simple setup here. I have my mobility band looped through a rig here. You can use a TheraBand or cables at home. Those work just fine. I'm going to take my outside hand, grab a hold of the band here. Okay, take my inside hand, overlap my outside hand. All right. Get some good tension on the band, feet shoulder width apart, unlock the knees here. Band is just underneath sternum, all right? And before we press out, we're going to activate our core, so we're going to squeeze our abs, and we are going to squeeze our glutes, right? And then when we press out, we're going to go nice and slow, all right? Hold for 5 seconds, and then back in, all right? We want to make sure that we don't let that band rotate us, right? We want to stay stable within the spine, stable within the core. Press out, hold for 5 seconds, and then back in. Now, some common faults with this include holding your breath, right? We don't want to hold our breath because that takes away from the core stabilization, all right? So instead, we are going to exhale on the way out, breathe through our nose for the 5 seconds, and then breathe normally on the way back in, all right? Another common fault is hiking our shoulders up when we're pressing out, all right? This is a common sign that we're recruiting our trapezius muscles, all right? Instead of focusing more on our core muscles here, okay? So keep those shoulders down, keep those shoulder blades in your back pockets. Press out, hold for 5 seconds, and then back in. Finally, we want to make sure that we activate those glutes the entire time, all right? We don't want our center of gravity shifting around during this. We want to stay stable, all right? So we're squeezing those glutes as we press out. Hold, 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 and then back in. Finally, okay, if you notice that it's difficult breathing one side and then we flip around, and it's not as difficult breathing on the other side, that means there's some asymmetry in there. We need to address the diaphragm, all right? I usually recommend doing 10 reps facing one direction, turning around, 10 reps facing the other direction for a total of 3 sets. All right? Now, if you have any questions on this, please contact me. Once again, I'm Dr. Sam Bisson, Pro Chiropractic.